Well, good morning, everyone. Long time no see. I'm Bob Ravenscroft, one of the vice presidents here at Bryan Health. This is our first briefing of kind of this manner since early August. That's not to say there hasn't been tons of media access into Bryan and other health systems throughout Nebraska, but unfortunately, there's need to address you again. With us today is infectious disease physician, Dr. Jim Nora. Many of you who have followed along are familiar with him, as you are pediatrician, Dr. Sian Jones-Jobst. And they're going to share a little bit of information, namely about the importance of vaccination for kids and new learnings about the Omicron variant. So, first of all, thanks to the members of the media for publishing information about the variants, boosters, and the status of this pandemic throughout the process. You're doing a great job learning as we learn, adapting, and then also we understand there's a ton of fatigue about COVID out there, and we just cannot stress how thankful we are, your diligence to continue reporting on it. First of all, I want to be very, very clear with this. Bryan Health cannot state more strongly the importance of vaccinations and our position on this. It's the best defense for you and your family. It's becoming increasingly clear for us that you'll see from some of the statistics coming up that the booster is extraordinarily helpful for the original variants, Delta and Omicron. For the unvaccinated population, if there are any listening, if you are not concerned about yourself or those close to you, what we're imploring you to understand is the middling vaccination rates here in Nebraska are crippling the healthcare system. The unvaccinated population, as you'll see from the statistics, and it's consistent with hospitals throughout the state, are continuing to occupy beds at an unsustainable rate. It's backing things up. Last week on one afternoon, we had 29 Nebraskans in rural hospitals or small regional hospitals on a wait list needing transfer to a tertiary care for very serious things, in some cases life-saving care. It's been higher than 29, but we're almost always in a double-digit wait list. What that means to our team here, there's a house supervisor or a manager on the receiving end of those calls, and they're going one by one choosing who gets that next bed to transfer in. So obviously that's heartbreaking for them. Thankfully, Bryan Telemedicine is blanketing the state, and pulmonary care and other critical care are helping critical access hospital and regional hospitals really expand beyond their typical comfort level or capabilities. So just quick reference, in today's daily huddle, we currently have our 542 patients. There are 11 boarders in our ED and 30 patients in our observation units, and that is kind of what we're talking about. There are not beds to move them to yet, so that's going to create a wait list yet today. Before we get to the stats, just in closing, we really do not want interruptions to school schedules next semester. We want to catch up to the backlog of delayed care that is happening, and we want every Nebraskan to choose to be part of the solution. And perhaps more than anything, we want to provide some education on Omicron and the importance of vaccination for kids today. So before the physicians come up, here's where we're sitting today. As I mentioned, we have 542 patients at midnight. The first slide you'll see, since August, when the Delta variant really took hold, we have lost 147 people here at Bryan. Since the beginning of the pandemic, we're approaching 400. So that's what, 38% of all mortality and deaths related to COVID has happened since March. As you can see from our dashboard here today, on the left are the number of patients that are hospitalized with COVID and their vaccination status. You'll notice there is one boosted patient in there, and I did a little bit of digging because this is new. It's the first time it's happened to us. And what I learned about it is this person they were admitted for another disease state, unfortunately here for comfort care. And incidentally, they were identified as positive, but it is not COVID that brought them here, and it is not COVID that has put them on comfort care. As you can see on the right side of the screen, things continue to skew younger, and it is largely an unvaccinated population. As far as those that are the most critically ill in the hospital, self-explanatory there. It is still an unvaccinated population that is consuming the most expensive, intensive resources here at Bryan. And then this last one really speaks to the hospital capacity issue that we're talking about. If you look at the top, there's kind of a gray line there, and that is our normal staffed beds. The red line there is what we've identified as where we can, accommodate additional surge capacity. Every time we pop above that red line, that is where there's not a realistic place to put them. So you're boarding in the ED, you're using your observation rooms for inpatient care in essentially environments that are not typically used for inpatient care. Along the bottom, you see what's going on with our COVID numbers. And if you look at after our kind of the first big peak last year, when we dipped over the summer, all of a sudden you saw our hospital capacity coming back down to the levels that are typical for us to accommodate. As there was some information coming out of Omaha how they've had a 100% increase in the past month to drive them into the 70s. Unfortunately, at Bryan, we had our 100% increase in essentially August, and we've been between 60 and roughly 80 patients since August, and it's continuing to the present. So I hope that provides some insight to some of the things we're being asked about the pressure on hospitals and the current state of COVID patients there. As far as those statistics that I put up there, I would just like to say if people are interested in that, you can go to our website. We publish these daily for the public to understand what is happening at one of the state's largest tertiary care centers. Without further ado, I'm going to bring up first Dr. Jim Nora to give us a deep dive into Omicron and everything infectious disease right now.
So thank you for the opportunity to speak today. It's been a while since we've had so much news about COVID in such a short period of time, and there's always something new, but boy, the last week has been just one thing after the other, and really starting with Omicron, new variant identified in South Africa, and lo and behold, it's right here at home. So Southeast Nebraska had 6 cases, and this was imported. There was an individual who traveled from Africa and brought it into a household, and for a brief time, Nebraska had more cases of Omicron than any other state in the Union. So that was kind of an unusual situation. I wanted to give a shout out to our state public health and also the local public health that worked up this particular outbreak. So that was Public Health Solutions, but really fantastic work. It brought some great information, initial information about this variant, and not only was it useful for us, but it was really useful for the entire nation because it was so timely. And what have we learned about Omicron? So this is a variant that appears to spread very, very easily, definitely far more easily than the original Wuhan virus. How well it spreads compared to Delta remains to be uncertain, but with the outbreak that occurred in southeast Nebraska, we do know that there appears to be a reduced incubation period down to about maybe even as short as a couple days, and that will have to be verified by other data as we get further into this, but really appears to be a much shorter incubation period. And that's very important in terms of the epidemiology and the dynamics of transmitting this virus. In the individuals in this outbreak, there was one that had been vaccinated. And I had the chance to visit with Dr. Donahue, our state epidemiologist, about this case. And that particular individual who was vaccinated had the shortest duration of illness. So anecdotally, it looks like the vaccine does provide good protection. There has been some discussion about whether this particular variant is going to be less virulent. That would be great. It would have to be way less virulent to make up for the increased risk of transmission. And increased risk of transmission puts every hospital in jeopardy. Already we're running full, so while it would be great if it's less virulent, I think the fact that it appears likely that it's probably more transmissible, that unfortunately is bad news for hospitals and healthcare, and for anybody who's getting sick for any reason who can't get the healthcare that they otherwise need. So what to do if you have COVID right now in the context of this new variant? So if you have been vaccinated and get COVID now, probably you're going to be okay unless you're severely immunocompromised. Now, you'll be best off if you've been boosted. If you haven't been boosted, there's an increased risk you might get admitted to the hospital. But if you get admitted to the hospital, probably you won't end up in the ICU or on the ventilator. Now, there are always exceptions, but as a general rule, virtually everyone who's been vaccinated and has a normal immune system does well with COVID. And it appears that the Pfizer vaccine and probably the other vaccines will have decent protection against this particular variant, especially for preventing severe illness. So if you've been vaccinated and you get COVID, I would encourage you to follow up with your doctor about that. But hopefully you can just stay at home and we'll have a mild illness and be over it shortly. What if you had no vaccine? Well, so the most important treatment for you to get if you have new COVID and you haven't been vaccinated is a monoclonal antibody. And this is indicated for anybody over age 65, anybody with a number of chronic medical conditions, any female who is pregnant, anybody at any age, any adult that has a BMI of over 25. So what does it take to get a BMI over 25? Not too much. So it depends on your height, but if you're 5'10" and you weigh maybe 180 pounds, your BMI is over 25. If you're 5'7" and you weigh over 160 pounds, your BMI is over 25. Any of those individuals are at higher risk of having severe outcomes with COVID-19. If you have COVID-19 and you have not been vaccinated and you fall into that category, as soon as possible, get a monoclonal antibody. And you need to contact your local health department, local providers to figure out how to do that. It varies depending on region. Here in Lincoln, Bryan has a monoclonal antibody clinic. St. Elizabeth has a monoclonal antibody clinic. Those are two resources locally for that. So that's what we need to do for anybody who has not been vaccinated to reduce the risk of severe illness for those individuals at increased risk, which is a large chunk of the population. So I wanted to talk briefly as well about a new product that was just approved by the FDA last night. So I'm going to try my best to pronounce this. Tixagevimab silgavimab. No promises that that's the preferred pronunciation. The trade name is EvoShield or EvoSheld. It's made by AstraZeneca. It is the first PrEP monoclonal antibody that we have. So this is pre-exposure prophylaxis. So this is for individuals who are at high risk of not doing well with the vaccine. So somebody who has an underlying immune deficiency and is not expected to respond to the vaccine. We have seen people who have done everything right. They have taken the vaccine, they've tried to avoid contact with others, and yet they've wound up in the ICU and they've died. And that's because this virus is unforgiving, and if you don't have an intact immune system, you are at high risk of complications. This is the product for those individuals. So now you can get an injection every 6 months. And it's great that this lasts for so long. It will last for 6 months and provide passive immunity. The numbers look really good, probably at least 70% protection against severe illness. So I would encourage anyone who falls into that category to explore this product. It's not immediately available today. The approval just came last night. It will be a couple of weeks before it winds its way through the system. And of course, there won't be a huge supply of product initially, but absolutely pursue that if you fall into that category. Now, there's a second category that is eligible for this, and that's individuals that have had a vaccine but have had a severe reaction to it. So a severe reaction to the vaccine or any component of the vaccine. Because of that, no further vaccine would be recommended, so those individuals could also receive this particular product. This is a pre-exposure product for those two groups only. What about people with a normal, intact immune system? What sort of pre-exposure prophylaxis can those individuals take? And the answer is we have a great solution for that, and that's the vaccine. Vaccine provides superb pre-exposure prophylaxis. And so anyone who has not been vaccinated, I would strongly encourage you to do so. I would also encourage anyone who's eligible to be boosted to get the booster. We are seeing vaccine breakthrough cases. They end up in the hospital. They don't tend to be in the ICU or on the ventilator, but we would rather not have you in the hospital, so please consider getting the booster to avoid being hospitalized. So I think those were the bulk of the comments that I had, and I'm happy to take questions later on here too. Thank you.
That was great, Dr. Nora. I learned a lot. Well, I'm also, hopefully I've got that in a good position. I'm also here to talk about vaccination and hopefully encourage some people out there who maybe haven't had their vaccine yet or haven't either talked to their doctor or considered getting their child vaccinated. We now also have a great vaccine that is safe and effective for children in that 5 and up age group. So that's great news. We've been doing it here in the state of Nebraska and the country since early November. And so since it is the Pfizer vaccine, it's 2 doses, 3 weeks apart. We've actually been able to vaccinate kids with a full series now. I can say my 11-year-old has had both of her doses, and in just a few days she'll be considered fully vaccinated. So that's a good relief, great relief for us as a family, but also great for families in Nebraska and across the country. Lancaster County has been doing a great job getting kids vaccinated. I just checked with the health department this morning. We actually already have vaccinated 26% of the 5 to 11-year-old age group here in Lancaster County with their first dose of COVID-19 vaccination. That's pretty remarkable. A little bit over a quarter of kids already have had their first dose, and actually already 13%. So half of those that have had their first dose have already had their second dose. So we're well on our way to protecting those kids, but we need to do even better. Vaccinating everyone that's eligible for vaccination is our absolute best way of saving our hospital capacity and of keeping our community healthy. Kids do get COVID. They do have complications from COVID. We talk a lot in adults about mortality with COVID-19 infection, but in pediatric patients, mostly what we're talking about is the morbidity, the complications from that infection in the first place. So we do see kids who get hospitalized. There's been over 8,300 hospitalizations in pediatric patients due to COVID-19 infection, but probably more common, I should say, definitely more common is those long-term complications like MIS-C and long COVID. And so that's one of the reasons to get your kids vaccinated. One of the other reasons is also to prevent those secondary losses, loss of school and educational time, loss of ability to participate in sports, and also the risk that they pose to others, whether it's their friends, whether it's their family members, their grandparents, their parents. Maybe they have immunocompromised family members at home. Maybe their friends have immunocompromised family members at home, and protecting their teachers, their coaches. So it's not just for themselves, it's for everybody else as well. We also want to protect our hospital capacity. We're heading into respiratory season in Nebraska and across the country. And for pediatricians, that means this is our busy sick season. We see lots and lots of kids with RSV, influenza, significant respiratory illnesses that need hospitalization. And if our hospitals are full already to the brim, I don't know what we're going to do with those kids. We run out of pediatric beds as it is in the wintertime if we have a busy season. And if we are facing that this year, we will be in big trouble because we're using those beds right now to take care of adults. So that's the other reason why we need to protect our community. I get a lot of questions, obviously, about COVID-19 vaccination. One of the probably first ones I get is, well, I'm kind of interested in doing it, but I want to wait a bit until more vaccine has been given to kids so we see what the complications might be. And I think this next stat is sort of telling for that. In the United States, we've actually already given 5 million doses to the 5 to 11-year-old age group. That's actually 5 million individual children who've received their first dose. And actually over almost 2 million, 1.9 million kids have received their second dose of COVID-19 vaccination in just the 5 to 11-year-old age group. So if you're waiting for more doses to be given so that we can find out how it's going to go, I think we're there. We're a month in, we've given second doses, and it's going great. In that 12 to 17-year-old age group, we've given over 13 million, actually it's 13 million patients have completed their vaccination series, and we have a really, really good safety efficacy profile in pediatric patients and adolescent patients with that vaccine. So don't wait. Unfortunately, we have had kids in the office who've had their first COVID vaccination, and then they get COVID before they get their second COVID vaccination. And so now is not the time to wait when we're at, close to 15% positivity in the community. We are seeing high levels of disease in pediatric patients right now. Personally, in our clinic, last week we were at about 15.7% positivity rate with the testing we did. In the month of November, we were at close to 12%. We did 1,100 in-house PCR tests for COVID-19 in our pediatric practice last month. So we're doing a little bit over 1,000 tests per month with pretty high positivity rates. Those kids who aren't vaccinated, they can't go to school. That's the reality. Kids who are not vaccinated, who are exposed to those kids who have COVID-19, have to quarantine. And sometimes they're quarantined for extended periods of time. So they have to quarantine for a good 10 days after their last exposure to someone who's positive. So if they have it in their household, that might be a rolling quarantine of, well, it's 10 days after mom had it, but then dad gets it. So now it's 10 days after their last exposure to dad. So some of these kids are out of school for an extended period of time, and we want to try to prevent that by vaccinating them. If they're vaccinated and they're asymptomatic, they don't need to quarantine. They can just monitor for symptoms, get tested, and wear a mask. So that's a definite advantage for them to get their vaccine. I do have patients or families who ask me if they've already had COVID-19, do they need to have their vaccine? That's a great question. Unfortunately, the answer to that is they should get their COVID vaccine, and the reason for that is immunity to COVID-19 infection in pediatric patients is messy. They don't necessarily get the same levels of neutralizing antibody and memory immunity to infection as they do to targeted immunity by a vaccine. We know that that's the fact. And so although there are some patients who develop good immunity, it's very difficult to know who has good immunity and who doesn't, and who has good memory immunity. And so your best protection is our safe vaccine, and it is safe to get the vaccine even though you've already had COVID-19 infection. So yeah, your child should get their vaccine if they've had COVID-19. I actually have patients who have had COVID-19 more than once in my practice. So it is a good idea to get your vaccine. As far as contraindications to the vaccine, there aren't very many. It's really allergy to the vaccine or any components in the vaccine. There aren't a lot of ingredients to the vaccine, so it's unlikely you're going to have allergy to any of the components. But if you're concerned about that, please check with your physician. You can see the list of ingredients online. Actually, the paperwork you signed to get your vaccine has a list of the ingredients as well. And so that's something to consider. As far as side effects, what we've been seeing in the office is really just kind of sore arm, pain at the site of injection, maybe a little bit of redness or tenderness at the site of injection. The 5 to 11-year-old age group really hasn't been having the same level of fatigue or fever after vaccination that some of the older kids and adults have had. That's probably because it's a lower dose. It's also probably has to do with how their immune system functions. It just doesn't have as robust of a response as far as side effects are concerned. Major side effects of the vaccine, the good news is we really don't see major side effects of this vaccine. I know there's been a lot of talk in the media about myocarditis with COVID-19 vaccination, and I've had a lot of parents ask me about that. That is an extremely rare complication of COVID-19 vaccination. I believe the stat is 26 cases per million doses. And the myocarditis that we've seen with COVID-19 vaccination is mild. Myocarditis the definition is inflammation of the heart muscle, and it can be anywhere from mild to severe. And what we're seeing with COVID-19 vaccination, those cases have been mild. COVID-19 infection, on the other hand, can cause myocarditis, and it is not mild. And you're also more likely to have COVID or myocarditis from COVID-19 infection than you are from the vaccination. So without a doubt, it is definitely better to get your COVID-19 vaccine than it is to get infected with COVID-19 when it comes to that myocarditis risk. I've had a lot of parents also ask me about rumors that they've seen on social media and the internet about infertility. There's absolutely zero evidence that COVID-19 vaccination causes infertility. In fact, if you look at one of the largest demographics of people who got the vaccine over a year ago, or just about a year ago actually, were childbearing aged women. Healthcare workers. And we have not seen an uptick in infertility. We have seen pregnancy loss, and we have seen death of women who are pregnant from COVID-19 infection, but not from vaccination. And so I think that's an important thing to keep in mind. I have 2 children. They're both girls. One is 11, one is 13. I have them both vaccinated fully for COVID-19. I would highly recommend that for your children, and I wouldn't do it for my patients or for my children if I didn't know it was safe and effective. So I think that's probably the main points I wanted to make. And if anybody has any questions, I'm happy to answer them.
Me too. All right. We did have a couple of advanced questions. I'll take the first stab at and then get some physician backup on it. Let's see. The first one is, can you explain why there seems to be a disconnect with the state dashboard, which shows we have less COVID patients than last year and ample staffed bed capacity, but hospitals are reporting near full capacity? I don't think there's probably a good answer for it. What I can tell you is what we're sharing is happening at Bryan is what is happening, and we are at full capacity. I think what is causing it at a place like Bryan is a couple of things. First of all, there's a pent-up demand for care that's, we've had 20 months of disruption that's created that pent-up demand for care. At Bryan, since August, we've been averaging between 60 and 80 COVID patients on any given day. Additionally, what we have is there's what we call 20 to 30 holds a day. And that's being patients that are ready to be discharged from a hospital but maybe can't for a variety of reasons. One, long-term care facilities are not all taking unvaccinated patients, so they have to stay here until there's other places they can go. There's a handful of sexual offenders that can't go to long-term care facilities, and there's a few power of attorney issues. So if you add those 20 to 30 situations, some COVID-related, some not, to the 60 to 80 COVID patients, that starts squeezing capacity. Additionally, what's kind of impacting this right now, too, there's, 136 outbreaks in long-term care facilities across the state, so that's minimizing what they can accept as well. Is there anything you'd like to add about that, Dr. Nora, or does that kind of describe the situation?
I think one of the challenges from a hospital standpoint is how do you measure strain on a hospital? And there's really not a lot of experience in doing this because we haven't had a pandemic anytime recently. The way we have been doing it is kind of like the fuel gauge on your car. It's more of a reverse fuel gauge, so that as you approach full, then that's where we get concerned. But I would submit that that's probably not the best metric for measuring strain on the healthcare system. I think a better analogy might be the temperature gauge on your car, and normally that should run in the middle. Even in winter and summer, there's not that much of a difference. But when it starts to get up towards the edge where it gets really, really hot, that's where it does a lot of damage to your engine and puts a lot of extra strain. Same thing in the healthcare system. So a healthcare system running at or near capacity for prolonged periods is really putting a lot of strain on the system, and patients can't get in, get out the way they normally would. So when this is all over and done with, I'm sure people who think about this will review how we might do health system strain metrics better. But that would be my 2 cents on capacity. Another thing to mention is, every hospital, every healthcare system is going to do whatever we can to take care of patients that come in. So if we have patients that show up and need care, even though we don't have as many people, the resources that we ideally need, beds get opened up where there shouldn't even be beds, and then suddenly that adds to the capacity on some of these dashboards, and that doesn't really reflect strain in any way. And if anything, things are super strained, but maybe there's a little bit of extra capacity. So, we appreciate everything that is being done in the outpatient world, people choosing to get vaccinated to help prevent getting hospitalized, because right now things are just filled to the brim, and we absolutely want to do everything we can to minimize hospitalizations from COVID-19.
And I think that question came from Andrew. I think another thing that complicates it is not all hospitals or all floors are they're not all equal. So when you have places like Nebraska Medicine or some of CHI's larger hospitals, a Bryan, a Methodist, they can be at full at capacity, and some of the other capacity that might be available in the state just can't deliver the type of care needed. So it's murky at best and challenging, and the gears are being grinded pretty hard. This one would probably be for you, Dr. Nora. Can you speak to the level of immunity in unvaccinated people who previously had COVID-19?
So that's a great question, one we get a lot too, and especially early on when we didn't have vaccine, it was a pretty good deal to have a mild case of COVID. And then the thought was you had probably at least 90 and then 180 days of immunity. But the type of immunity from primary exposure to COVID wanes with time, just as it does with vaccines, but it absolutely wanes. And there's a lot of concern that people who had some of those earlier strains of COVID, the original COVID strain and maybe even the alpha strain very early on, that those individuals really are losing any immunity that they had, and that they are also, the immunity that they had also doesn't match real well with the current strains that are circulating, so Delta and now Omicron. So that's the concern with individuals that have not had a vaccine but have had primary COVID. The best thing to do is to get a vaccine after that. And people who have had primary COVID and then get a vaccine go on to have very robust immunologic profiles. So it looks like those individuals tend to do very well. But definitely getting that vaccine is what's needed to sustain immunity and to give you broader coverage against some of the new variants. And I will also add, too, that as these variants get further and further away from the original strain of COVID, there is some discussion about whether a new vaccine will be coming out. And that's very possible. And I think that would be a great addition to our current vaccines. Of course, that won't happen instantly, but it may be that that's what will be needed. But for now, for Delta, for Omicron, the current vaccines appear to offer good protection against severe illness. So if you have had primary COVID and have not been vaccinated, I would strongly encourage you to get vaccinated.
I think you probably addressed this in your remarks, Dr. Jones-Jobst, but there was a question, so I'll pull you back up. What do you tell parents who feel the large majority of kids are not severely affected by COVID and natural immunity is better than vaccines?
Well, I did talk about this a little bit. Oh, let me take my mask off. I did talk about this a little bit, but I'll go into a little bit more detail. Kids do suffer from COVID. A lot of the things that they go through due to COVID has more to do with loss of their ability to participate in school, and then how that affects their parents when their parents can't work because they have to stay to take care of them. But we do see kids who end up hospitalized with COVID, typically not here in Lincoln because we have a children's hospital not very far away that tends to take care of those more critically ill children. Most of the complications we see from COVID-19 infection actually are late complications. So they don't end up in those stats of, morbidity due to actually active COVID infection. The patients with multisystem inflammatory syndrome in children, or MISC, those patients end up hospitalized and in the ICU somewhere 5 to 6 weeks after their initial COVID infection. And in fact, oftentimes those kids had asymptomatic infection and we didn't know that they were infected until we go ahead and do antibody studies to show that they had previous infection, or we know that they had a contact. So the reality is we do see kids who have complications from COVID-19 infection. It's just not true that they don't get that sick or that they don't have problems from it. As far as natural immunity is concerned, I kind of talked about that a little bit, but I'll go into a little more detail. Natural immunity for COVID-19, especially in kids, because many of them do actually have mild infection, isn't very reliable. And so, as I mentioned before, I've had kids who've had COVID more than once, separated by many months actually. And so they probably had that initial variant or the original strain that came through, and later were infected with the Delta variant and didn't have overlapping immunity. And so the reality is we do see kids who have breakthrough infection after they've had an initial primary infection. And the reality is the vaccine is safe, and natural immunity means you get sick. And when you get natural immunity, you're likely to infect others as well. And when you get your vaccine, you are not contagious. You are not going to have COVID-19. You can't spread it to others. So the reality is vaccination is way safer than acute infection with COVID-19.
All right, we'll give it about a few seconds here to see if any additional questions come in online. Going once, going twice, okay. Thank you for your participation, and again to the members of the media, thank you for everything you're continuing to do to be an extension of our care team, and we just implore every Nebraskan to be part of the solution and come together as a state, and let's get in front of this thing. Thank you.